Adenocor mechanism of action, indications, and contraindications. Adenosine is an endogenous nucleoside that specifically affects the atrioventricular AV node. It activates adenosine A1 receptors, temporarily inhibiting electrical impulse conduction through the AV node. This leads to 1. Mechanism of action. Adenosine is an endogenous nucleoside that specifically affects the atrioventricular AV node. It activates adenosine A1 receptors, temporarily inhibiting electrical impulse conduction through the AV node. This leads to 1. Mechanism of action. Decreased conduction. The speed of electrical impulse travel through the AV node slows down, resulting in a slower heart rate. Reduced automaticity. Adenosine suppresses the AV node's automaticity, decreasing its ability to generate abnormal rhythms. 1. Mechanism of action. Adenosine's specific AV node effect is also helpful in identifying the cause of tachycardia with a wide QRS complex. Pharmacokinetics. Adenocor, a drug containing adenosine, does not require liver or kidney function for activation or inactivation. Liver or kidney impairment does not affect the drug's effectiveness or tolerability. 2.1 Indications. Paroxysmal supraventricular tachycardia (PSVT). Adenocor is indicated for rapid conversion to sinus rhythm in cases of PSVT, including Wolff-Parkinson-White syndrome. 2.1 Indications. Myocardial perfusion imaging. Adenosine is used to dilate coronary arteries in conjunction with myocardial perfusion imaging or echocardiography to detect perfusion defects or regional contractility abnormalities due to coronary artery disease. 2.2 Contraindications. Sick sinus syndrome. Adenocor is contraindicated in patients with sick sinus syndrome due to the risk of excessive bradycardia. 2.2 Contraindications. Second or third degree AV block without a pacemaker. Patients with second or third degree AV block should not use Adenocor due to the risk of exacerbating conduction block and inducing cardiac arrest. 2.2 Contraindications. Patients taking angiotensin-converting enzyme ACE inhibitors. Adenosine can increase the risk of severe hypotension in these patients. Patients with a history of asthma or chronic obstructive pulmonary disease (COPD). Adenosine can cause bronchospasm, worsening asthma or COPD symptoms. 2.2 Contraindications. Patients with severe heart failure. Adenosine can worsen heart failure in these patients. Patients with porphyria. Adenosine can increase the risk of developing acute abdominal pain due to porphyrin. 2.2 Contraindications. Pregnancy and lactation. There is not enough evidence to determine the safety of Adenocor during pregnancy and lactation. Therefore, the benefits and risks should be carefully considered before using this drug. Important notes. Adenosine is administered intravenously slowly, usually over 10 seconds. The drug has a short duration of action, lasting only a few seconds to minutes. Important notes. Patients should be closely monitored after receiving adenosine to detect potential side effects such as hypotension, bronchospasm, nausea, vomiting, chest pain, dizziness, bradycardia, etc. Important notes. Adenosine should be administered by experienced physicians in a medical setting with adequate emergency equipment. In summary, adenosine is a useful drug in treating paroxysmal supraventricular tachycardia and assisting in myocardial perfusion imaging. However, the drug has several contraindications and potential side effects that should be considered to ensure patient safety.